Yeah, that's what it is. And then also,
Can you guys hear me? Thumbs up, thumbs down,
Yes, we can hear you.
around. I can't see anyone.
Can you hear me?
Oh, perfect. Thank you, Jason. Introduce her, Chris, or me?
no, you can't. What I could do is, yeah, I'll do,
Q&A.
yeah.
You want to do Q&A?
Yeah, but I don't have a computer.
You can come up here. All right, you guys ready to get this party started? Sorry, we're still getting it together in here. All right, everyone. Good morning, good morning, good morning, and welcome to Wednesday morning, 1 Million Cups in Northeast Tarrant County. We are grateful to have you guys here with us today. I like this podium. I feel like I'm talking on a microphone. Can you guys hear me okay?
Oh, yeah.
Can you hear me good? You guys can hear me okay in Zoom world? Awesome. Okay, well, we are excited to be here this morning. We have lovely guests in the room. We have lovely guests on the Zoom. Kind of rhymes, right? Room, Zoom, you get it. Okay, so I don't know how to advance the slides though. There we go. 1 Million Cups. Our mission is to help current or aspiring entrepreneurs succeed in their endeavors by establishing a supportive space where they can test, tweak, or simply validate their idea while connecting them to similarly diverse members of their communities, which are you. We also want to ensure that any entrepreneur or wanapreneur has at least one clearly defined path to access both business resources and their community. How does 1 Million Cups work? Well, each week we have 1 to 2 presentations where the presenters come on to share their story. I won't go through the semantics of this part in detail. However, they're not here to sell. They're not here to get investment or to technically gain direct exposure, but they're here to share their business journey. They're here to tell a story, their milestones, and most importantly, an obstacle or a barrier that they are facing. The presenters have 6 minutes to present their business to the community, which is typically followed by 20 minutes of Q&A. Sometimes we do also have educational components where the presenter provides 20 minutes of education, and then the community jumps in and gives Q&A, which typically is about 15 to 20 minutes or so. We also have community updates because we want to make sure that we are sharing your events. We want to make sure that you are highlighted and that we are able to support your efforts. We could not do a lot of things without support from sponsors and community members and organizers. So here is a list of our current sponsors. We have the NRH Library, who provides an amazing space for us every Wednesday morning. Not to mention they come in early just for us. So if you are ever at the NRH library, give them a big thank you because they have been supporting us since July of this year. So thank you so much. We have the North Texas Entrepreneur Training Center who provides the coffee, and we have the cultural consultants who then provides our speakers with their handy dandy 1 million cups tumblers. If you've been a presenter and you've received your tumbler, give a shout. If you have it, you can raise it, however you want to do it. We're not toasting, but if you want to toast, you can. And here is that group of amazing organizers that I spoke about. We have myself, Craig Holst, Shay Jackson, Natalia Gajic, Camille Kerner, Hank Johnson, Elizabeth Copeland, Jack Bradshaw, and Michonne Landry. If you see them, give them a wave, say hey. Okay, so now it is time for Who's in the Room, and we want to get to know some of our fabulous visitors that we have. I have to expand my screen a little bit. So I am going to start with who's in our room, and I'm going to let Craig choose who introduces themselves.
Yes, I am going to pick on today Michelle Hill of All Jumped Up. Michelle, if you wouldn't mind introducing yourself, what you do, and welcome to 1 Million Cups for your first time. The speaker's up at the podium, so you're going to want to speak loudly.
Okay. How's this? Is that good?
Can you guys hear her?
All right. My name is Michelle Hill. I am with All Jumped Up, and we provide jump removal and hauling services.
Awesome. Thank you, Michelle, and welcome. Craig, do you want to give it over to anyone else?
Let's see. Yeah, I'm just going to pick on him because he's a very steadfast participant with 1 Million Cups, but for some reason just can't get over the hump of presenting. So I'd like to pick on David again to introduce himself so he can at least kind of break the seal a little bit.
Tell him to turn his camera on.
Yeah, and David, turn your camera on.
Good morning, everyone. My name is David Garno. I'm with Metro Light Solutions. We are a branding company. Basically, we help you with your brand to make it noticeable and more and unforgettable. We do all things promotional, from traditional print to customized promotional print, and even customized apparel that make you look good. Of course, David Garno, Metro Light Solutions, your one-stop branding solution.
Woo-hoo! Thank you, David. And David is a steadfast 1 Million Cups, and he's also the preferred market tchotchke provider for the Center North Texas. Woohoo! Go, David. All right. So on Zoom World, I'm going to call on Mr. Alan Crawley. Are you there, Alan? Would you like to introduce yourself?
Yeah, good morning. I'm Alan. I work with entrepreneurs and in the entrepreneurial
You're
space.
talking, we can't hear you.
Interesting. Well, I'm off mute.
Yes, no. So,
We can hear him.
all right. Well, oh, you heard him?
Yep.
We didn't hear him.
So once again, I'm Alan.
You guys
Crowley,
met
and I
him,
work
so
with
great.
entrepreneurs.
That works perfect. So thank you so much for your introductions. Hopefully we can get you guys to the podium so that you can share your business presentation with us. So without further ado, I would like to introduce our speaker for today, who is coming back to us to do a refresh. So this individual is no stranger to the 1 Million Cups community. She was a former organizer for the Fort Worth chapter, and she has done amazing things for the Northeast or the Tarrant County community as a whole. So she is now the owner of Your Healthcare Nurse Advocates, and she is going to share with you her journey and how her business has blossomed since she has last presented. So I am going to stop sharing and I am going to turn it over to none other than Miss Diedra Kindred.
Well, thank you, Darlisa. It's a pleasure to see everyone and to be able to return to stomping grounds of 1 million cups. So happy to be here. So I guess 6 minutes, right? Let me share my screen here. Okay. Can you guys see my screen? Yay, nay? Okay, awesome.
We can
awesome.
see it.
Awesome. Thank you. Thank you. Thank you. So first of all, thank you to 1 Million Cups, Northeast Tarrant County. It's an honor to be back. My business was established in September of 2019. So about my business, we are not a home health company. We are educators, advocators, and navigators. We are experienced nurses still working in the complicated healthcare system that want to help people understand their journey. My why. My one why is that when you come into the hospitals or the healthcare system, you are confused by the information that we throw at you. My second why is my mom. My mom became sick and ill around the age of 52, and she had Parkinson's, dementia related to Parkinson's, asthma, colon cancer, and MS. So that's 5 physicians who didn't have the time to talk to one another and help her adequately navigate her healthcare journey. So as a nurse, I knew the questions to ask. I knew what was coming next. I could help her plan for her medical journey. Our mission is to educate and empower individuals and their families to be able to take control of their own healthcare journey, because many people have no clue about the healthcare system. Our vision, we will be the first led nursing advocacy agency in Dallas-Fort Worth. Our goal is to help decrease your stress level and save you time by really handing you and educating you on what's next, your medications, your disease process, what do you ask, who do you go to, where are the resources. Our market is those busy individuals, such as ourselves, who have loved ones who are going to their doctors and they have no clue what the doctor just stated, or how are you going to put the pieces of the puzzle together? Geriatric population, seniors who live alone, those who are battling chronic illness or a new diagnosis, and especially those who you live out of state and your parents live here or your loved one lives here, and you really want to be involved in their healthcare journey. The problem, the average time spent at a doctor's office is 3.5 hours out of your day. That means picking your loved one up, getting them to the doctor, waiting on the doctor, talking to the doctor, getting your medications, getting home, getting that organized. It's a time-consuming event. 85% of the general population does not understand their loved one's plan of care. So we got a big, big need out here and a big, big problem. Excuse me. Our difference, we are privately paid. We are not paid by the hospital. We're not paid by the insurance company. That means we work for the clients that we serve. We specialize in knowledge-based educational disease processes and medications. Changes. Oh, there have been many changes. So we have started patient safety speaker opportunities with the Care Partner Project. We have continued to develop partnerships with other organizations such as Alzheimer's Center, Cancer Care Services to implement programs for teaching and education. I've started my podcast, Health Chats Among Friends. We're booked through the next year. YouTube channel, Talk About Tuesdays, where I talk about different healthcare tips that the general population has no clue about, like masks versus washing your hands and COVID changes. I have obtained my board certified patient advocate certification. Starting next quarter, we are going to be implementing medical binder sessions for individuals and groups to put you in charge of your medical journey. We have contracted with certified senior advisors to help us with the heavy client loads. We have trademarked our new business name and logo. And we've incorporated a HIPAA compliant communication system with families and medical personnel so everybody can stay on the same page. And my website has been updated. So without further ado, my name is Diedra Kindred. I'm a nurse advocate, educator, and navigator. Our company helps serve those who are confused by the complicated healthcare system. We are rocking and rolling, and we're educating and navigating. Thank you for your time.
I can't see myself, and I'm talking out loud that I can't see myself. And I just need to start the video button. So I apologize. Good morning, everyone. Unfortunately, Diedra broke the golden rule with presenting to 1 million cups. She actually took 6 minutes and 1 second. Shame on you, Diedra. In all reality, I think she just set the world record for the Northeast Tarrant community with the shortest presentation, the most concise presentation. But really the question now is back on to Diedra before we open it up to Q&A and allow her. She presented, 10 months ago, Diedra?
It was our first.
Yeah, she was our first presenter. And you did give us an update as to what's gone on since 2019. But how you doing? How's it been the last 10 months? And
Oh my goodness.
what are some hurdles that you still face, and opening it up to the rest of the community here, and maybe some ideas on how to mitigate or overcome those hurdles. So how you doing, and what are your hurdles?
Oh, I'm doing great. Thank you for asking. My hurdles. Okay, so what I have learned, there is 2 different worlds of networking out here. There's the healthcare world, and then there's the regular business world. So my hurdle is educating people of what a private patient advocate is and the value in having a private patient advocate. So I've partnered with other organizations such as the Alliance of Professional Healthcare Advocates, Greater Advocates, National Advocates Now, Advocate Health Advocate X, and the Alliance of the Aging and Disability. So being able to partner with those organizations and try to do some strategic planning on how to get the word out about private duty patient advocates. So that's been a big hurdle, because lots of times when I go to a doctor's visit with my client, they're kind of like, what is it that you do exactly? And then once they get to talking and seeing what we do outside of the system, how we help people get access to resources, that's when the aha light comes on. So in order to get over that hurdle, partnering with these organizations that the layman's world doesn't know about has been key.
Thank you, Diedra. Sounds like you got an alphabet soup of organizations that you're trying to navigate through. And so I'd like to, I'm going to open up my chat box here and scan if there are any questions. But for anybody that does have questions, please raise your hand and we will get to you. I'd like to reward the folks that are here in person though first, if they have any questions, and offer the floor to them to ask Diedra any questions. Anybody in the room would like to, yes, Jack.
Diedra, hey, great presentation. Really, looking at your business looks like a great business, and I can think of many clients that could really use what you are offering. And what's your territory? How far do you go?
Oh, that's a great question, Jack. So initially, when I started this company, I said I was going to be Colleyville, South Lake, Grapevine, that area. Now I am DFW.
I figured that pretty happened pretty quickly, right? Someone calls from Fort Worth and you're like, oh, I can get over there.
Right.
And then, so how do you work, how do you kind of work if you get somebody who's really, to the point of hospice and everything, do you help with that as well and getting that set up? You go that far?
Oh, that's an excellent question. I'm so glad you asked that. So what happens is that there's no client that's the same, right? So what we do is we start off with a 30-minute phone consultation. I'm hearing your story and I'm listening to where the gaps are. So for example, one of my clients, she needed help finding a home health company. So we were able to sit down and formulate some questions to help her know what questions to ask a home health company. I have another client, she has 9 physicians. She has a busy schedule and she gets so confused with coordinating that care. So we step in and we help coordinate that care so she can still have a life. I have another client that we just do weekly visits just to make sure everything is okay. And then I update his family on how things are going. So lots of times it's helping the client find the resources that are available. So when it comes to hospice, yes, I can help them find a hospice company. I have a plethora of resources. And when I say a plethora of resources, I've been networking in the healthcare arena since 2012. So I vet my companies very, very closely. I know the people who are working in those companies. So when I send a referral over to them, they already know that they better answer and they better take care of my client or they're going to see a side of me that is not very pleasant. But
No, that is great. And even bringing that resource is so valuable. And so from a Medicare standpoint or insurance standpoint, are you covered? Is some of your services covered? How would that work for maybe just an average person that's getting into multiple health issues like?
I'm truly glad you asked that question, because did you guys know that insurance runs medicine? You can sit down with your doctor and you can talk about a life-saving medication or procedure, and your insurance company can say, we're not paying for that. So we are privately paid. We refuse in our organization of private advocates to have insurance regulate the what, how, and when we can educate and help our clients. So it's a catch-22, right? Because, you want your insurance to pay for it, but insurance tells the provider what they're going to pay for and what they're not going to pay for. So with us, we can give you the good, the bad, and the ugly and help find you resources to kind of pivot around, being denied by your insurance company. So there are other advocates out here that help you navigate insurance. There are other advocates out here that help you learn about your hospital bills. When you get those surprise hospital bills, that's what their specialty is. My specialty is definitely medicine, heart, lungs, kidneys, chronic illness, things like that, your medications, things like that. So I partner with other advocates. That's their specialty. I stay in my lane and I help you get to the right resources so you can get that professionalism from someone else. So great question on the insurance.
So when you get that surprise, so you've got a client and they get that surprise hospital bill, they're like, oh my God, I didn't know this $9,000 was coming. And I have seen that happen.
Right.
Even firsthand. Will you help them negotiate that and maybe even put them on a payment plan? Because a lot of times seniors I know my mother did not feel comfortable doing that. So we helped her with some of that, but having somebody like yourself or somebody on your team do that could be very important for clients as well.
Absolutely. So I will reach out to another advocate that's their specialty. So there are plenty of advocates. What I found out about this business, Jack, is that, I was like, oh my goodness, this is such a need from a personal and a professional standpoint. And then for some reason, God started bringing me all these other resources of other advocates that are across the United States. There's about maybe 500 of us across the United States, but people don't know about private advocacy. So that would be me reaching into finding them an advocate that specializes in that insurance realm, because I don't want to do a disservice to any of my clients. So I have no problem saying, this is the person you need. That's the expert. Please connect with that person. And I introduce that person to my client.
it's amazing when you start something like you have, how if you follow it, some amazing things happen. So I would like, so this is not a question, but we are bringing back our senior services networking group this next year. We kind of put it on hiatus. And I would like to ask you if you would be our January presenter.
Just let me know the date. And I thank you for asking that because that's what I love. So I also do speaking engagements. It's called the Care Partner Project. It's a nonprofit organization. And what we do is we educate the community and their loved ones about how to keep your loved ones safe and sound in the hospital. How can you work with the providers that are in the hospital? How to cope with COVID, alone in COVID. That's another presentation. Another presentation is 10 times you need to speak up in healthcare. So we are definitely willing and waiting and eager to educate the community of how you can be your own advocate.
Thank you.
Thank you, Jack. I'd like to call on Janice Spooner to ask a question from the virtual side.
Awesome. Good morning, everyone. Diedra, I got to see you on your first presentation and you've just done stellar. Great job the first time. Great job today. So I have 3 questions that I'll just throw at you and you can answer them. One, is there a group that any of us that you've been wanting to connect to, a professional that we can help you make that connection? Please, if there is, please tell us. 2, is there a way your client could advise their physicians ahead of time by sending them any of your information so that they kind of know that you're coming with them and what that role is to help those appointments go quicker? And then 3, can people come to you to pre-plan for their needs, to know resources like a consulting fee, a one-time fee? I'm just thinking about my aging in-laws. Obviously, I like to pre-plan and make things go well. So just curious, those are my questions. Great job.
Oh, awesome, Janice. So great question. So groups to connect. So as far as groups to connect, it would be, so many out there. I've been asked to speak at women's groups, Rotary clubs, sometimes chamber events, because these are educational events, senior community centers, senior networking groups, because there's 7 that I belong to out here. So just being able to educate people, especially the senior community centers, when they start opening back up and things like that. So anyone who wants to learn about how they can help their loved ones, any group that's willing to, hear educational presentations. The second on client advice and MD. So what happens is that HIPAA has to be signed. So I have HIPAA release forms, and many of the hospitals and doctors' offices have their own special HIPAA release forms. So that has to be a definite form that needs to be filled out before my client onboards me or I onboard them. So there's several ways that can be done. They can sign my HIPAA release and I notify the doctors, or they can notify the doctors that I'll be there at that next visit, or I can go into their, with permission from them. A lot of seniors like me to navigate their patient portals, because not all patient portals are created equal. And if you got more than 3 doctors, they probably are not on the same patient portal. They're not talking to one another. Nobody knows who prescribed what or why. So that's where we come in, helping fill those gaps in that communication loss. And then 3rd, pre-planning needs. So I'm so glad you asked that question, because what we do after we do our free 30-minute phone consultation, and if you can't afford my services, I'm finding you resources that you can look at. If you can, we set up a in-home needs assessment. Anybody can do that in-home needs assessment. So I come to your home, you can have your lawyer, your cat, your dog, your cousin, your sister, your brother, whoever is going to be involved in your medical care, all your medications, all your doctor's names. So I'm putting together, I love puzzles. I'm addicted to puzzles. So I'm putting the pieces of the puzzle together for you and with you. So I'm giving you a plan that you can implement with parties involved Or I can help you implement that plan. I want to know your goals. And then I can help you reach those goals by sitting down and with you and saying, okay, this is what we need to do first. Because I give you everything, you're going to shut down. So great questions. Thank you.
Thank you, Janice, Diedra. I'd like to call on Alan Crowley, if you, your hand's up.
Yeah, Diedra, I've got my T-shirt on from Startup Weekend where you came up with that idea, or at least brought it to the forefront. Hey, fantastic. I'm really glad you've come as far along with that business as you have. It's wonderful to see people doing private pay activities in healthcare. Really need that. Yeah, what's it been, about 16 years that since we wrote into law the insurance companies instead of the doctors and citizens. Anyway, that's an important point, and I'm really glad you're thriving in this environment. How can, kind of going back to that original question, how can we help you and navigate the very, like you said, you're in like seven senior networking groups, right? So there's probably twice that number of business networking groups in the area. How can we help get you connected and kind of fill in the puzzle pieces for you on that end?
Well, that's great, Alan. You know, to me, is most of my clients are word of mouth marketing, right? You know, and I don't want to sit here and say ask for clients because I have plenty. Right? My thing is just spreading the word about this, the idea of private advocates. Because there's plenty of organizations. So many people are confused. Like when you're hit with a devastating diagnosis, think about a private advocate to help you along the way. And I hate to sound like a sales pitch, but that's the best way, is spreading the word, because this is my year and the next year is of planting those seeds, you know, educating people about what is a private advocate. Did you know they were out here? Did you know they even exist? They do exist. So just being able to, you know, just look into everybody, look into being in charge of your healthcare journey. Look into investigating your doctors and the resources that you are told about. Look into that and being able to map that journey out for you personally. Just because someone else did it, or you know, someone else in your family did it, it's not your story. Everybody's story is different. So be able to like, oh, aha, you were just diagnosed with congestive heart failure. Well, maybe you need to look into finding you an advocate to help you understand your medical journey. You know, oh, aha, you need a home health company, and the one that you have coming out there is not living up to their standards, what they promised you. Well, maybe you need to talk to someone to help you fire that home health company and find you another one. So it's so much information out here, and I really appreciate the time and the encouragement that 1 Million Cups has given me to push forward and to spread the word. So just spread the word about private advocates. That's all I ask.
We got a question on the chat from Dave Papenmeyer. And you've already kind of touched on this, Diedra, but other than referrals, how do you find your clients?
Awesome question. Building relationships. Building relationships with the physicians that I know, building relationships with the home health companies, the assisted livings, the independent livings, the memory care units, the senior attorneys, the attorneys that do work in elder law, the other organizations that I'm a part of, Cancer Care Services, Alzheimer's Center, Alzheimer's Association. So building those relationships and really sitting down with someone who is in healthcare, and I find out about their services. I understand, I take notes, and also when I bring them on as guests on the podcast, that's the key for getting those clients, because lots of people said, oh, I heard you talking to that Medicare person. I like to learn more. Of course, I'm gonna send you to them because I don't do Medicare, but that helps me be able to say, I have resources and you have not because you asked not. So just pick up the phone, talk to an advocate, research an advocate, and find out about those resources. So that's where my clients come from, word of mouth.
We have some Facebook questions and Darlise is going to read them out loud.
Yes, so the first question is, what is your growth plan? It sounds like you have lots to do. How do you plan to expand your company?
Ooh, lovely question. Okay, so guess my growth plan is to also empower nurses who are stressed out, burned out in the hospital system. They're kept under a glass ceiling. They are not real advocates. Yes, I said it. They are not real advocates. They're advocates for the hospital. Because once you go through that list of people that you got to see that day while you're at work, then that's it. Once they leave the hospital, that's when they need the advocacy. So my goal, my 5-year plan is this will be franchised. I will teach nurses how to be their own private duty patient advocates for people that they can help get through that journey. Also with speaking engagements, the next we've onboarded for this coming year, we've onboarded certified senior advisors who are equipped to help us expand and grow. We'll be looking into social workers and other nurses who are specialty nurses with at least 5 years experience in that specialty, oncology, pulmonology, renal, things like that. So there is plenty of room for growth, and we have a great 5 and 10-year plan.
Awesome. The next question is, do you anticipate changing from only doing private pay?
No.
All right. That's all. We got questions there.
Sweet.
No,
Okay,
because without private pay, I mean, like I said, insurance tells you what you can and what you can't do. So Medicare, love it, but they definitely do not pay for teaching about medications. And that's the foundation of your healthcare journey. How do you get off those medications? Are you plans to get off those medications? Are those medications still working? Medicare doesn't pay for the services that we provide.
Thank you. Any other Facebook?
Oh, no.
Okay, no more Facebook questions, but if you are on Facebook Live and want to ask a question, we'll capture it. I'd like to call on Miss Janae to ask Diedra some questions.
Good morning, Miss Diedra. First off, wonderful presentation. I'm like, Craig, you did that. You was moving. I was like, yes. I've heard you mention a lot about geriatric care. So is that your specialty, or will you work with pediatrics? Are there other areas that you focus in? Me as a mom with a child who has sickle cell and all of the different doctors that are inclusive of that, as she's aging out of the children's system where everything is kept in house and we're having to do different things, is there services within your company that we would benefit from, or is your niche market just the elderly community?
Great question, Janae. So I am not a pediatric nurse. So to me, your better service would be me referring you to a person that is they've been working with pediatrics. They're well-versed in pediatrics. They know what's coming next for pediatrics. I am basically plenty busy with our population of our senior population. There are at least 10,000 seniors a week coming into the healthcare system. My background is cardiovascular, heart, lungs, and kidneys. So I usually joke with people. I was like, that's plenty, and a little bit of Alzheimer's. But I would definitely refer you to a pediatric advocate that would help you much better than I could.
Okay, so that's the clarification that I was looking for. So it is the elderly community that currently.
Yes, ma'am.
But as you're looking in that growth strategy, are you going to look to pull in nurses that specialize in maybe pediatrics, I know that a lot of women are looking to do more of the home birth, the natural midwife. So you'll look to start going into those different areas as you're looking to
Absolutely.
franchise this out.
Absolutely, absolutely,
Awesome.
Janae. So that's what it's about. And so there's also an organization called it is advocateconnection.com. You can go and you can put in your zip code, you can put in what your problem is, and they will match you with an advocate that's in your radius. So like say, for instance, that you are having, you need a maternity advocate. Now there is one in McKinney, but just for the sake of, you just go to advoconnection.com, you put in, you know, what you need. It has several drop-down boxes. You can put in what your need is, your zip code, and then it will find your advocate. You can go and research that advocate, see what her background is, see if she or he fits, and it's definitely a great service. But if you want, when we get offline, I can definitely get you connected.
Thank you so much, Ms. Diedra.
That's a good comment.
Yeah, Janice, good comments, question. Deirdre, what social media sites are you on so we can connect and like your pages and watch your posts?
Awesome. So I'm on Facebook and I am on LinkedIn. And I have the podcast, Health Chats Among Friends, where I bring other industry professionals on to educate the community about their services. We have doctors, pharmacists, nutritionists, home health company, Medicare, Medicaid, the list goes on. And then I also have a YouTube channel. It's just Diedra Kindred. And I did that on purpose because I don't see me just narrowing myself into one space. So the YouTube channel is just Diedra Kindred. And on Tuesdays, I bring up just different topics called Talk About Tuesday. And I also post the podcast there as well. And I'm doing a little bit of Instagram, just a little bit.
Thank you. Thank you everyone for your comments. I do have two thoughts, Deirdre, sorry, gosh. That come to mind in hearing all about this. It's just healthcare is so complicated. All the different channels, all the different segments, all the different entities, like the doctors, they have their own goals, missions, and visions. And then you have insurance companies that have their own goals, missions, and visions. But where I'm going is it's just so complicated out there. I think anything that you can do to simplify. And the things that come to mind to me are what you do is you minimize physical pain, or you minimize the social pain. You possibly save time for your clients. You possibly save money. And then the third thing is you're essentially a non-partisan third party in an ocean of parties that are only fending for themselves. And so I think what I'm taking from this is a lot of these people out there that have a catalytic health event don't have somebody that fights for them or defends them, that knows what sword to use or which bullet to use or what shield to use at that particular time. And so I guess my challenge to you is, how can you simplify your message so it hits the heart of your target market, that it saves them time, saves them money, saves them emotional pain, saves them physical pain, or provides them trust. And what I find, because I'm somewhat ADHD, is infographics work well for me, where I can very quickly in a minute or two decipher. And I haven't been on your website, so I apologize, but that's just some thoughts that come to mind hearing all these questions and hearing more about your business. You're wading in very dynamic waters, and we're rooting for you. Thank you very much for your presentation.
Thank you.
Okay, so I'm going to go back to share screen, and we have a couple things we're going to talk about. First of all, community updates. Jack, are you handling community updates?
Yes.
Okay, Jack, the floor is yours.
Am I okay to unmute? Or is that gonna echo?
If you just want to speak loudly, or you know what, I'll
That's
mute,
all right.
I'll mute. Yeah, I'll mute.
Let's see if that works. Okay. You guys online hear me okay? Just a thumbs up? Awesome.
Yep.
Great. First thing I want to talk about is the Northeast Tarrant Business Expo tomorrow. We weren't able to do it last year, so we're very excited to bring it back. And all of you are invited to come. It's free to attend. It's at the Birdville Fine Arts Athletic Complex. It's right there. It's the stadium there on the second floor, right at Precinct Line in Mid-Cities. So come enjoy. First of all, it's your lunch. We've got about 15 different restaurants and caterers serving up food and showing their culinary capabilities. So you get to come and eat. And we space it so that you get a food sample and then you go meet some entrepreneurs and business owners that are there with their booths. And then you get another sample and then you meet some more entrepreneurs. And then you get another sample and you meet some more entrepreneurs. So we got some really fun restaurant and catering sampling going on. So it's come and go between 11 a.m. and 1 p.m. So you just show up. We got free Coca-Cola products too. So we're excited about that. So you show up, it's your lunch, you make some new contacts, exchange some cards, meet some really great, capable business owners. I think 3 or 4 of them that'll be having booths tomorrow are with us today. The cities will be there. So you can talk to your city people, like great economic development directors like Craig. And a lot of fun. So we hope if your schedule permits between 11 and 1 tomorrow, just come on down and check out the Northeast Tarrant Business Expo. We also have Angie Akmakian on the line, and Angie. Yes. So I was just going to say, do you want to just real quick on Toastmasters? You guys are roaring along.
Great, yes, Toastmasters Mondays here at the Chamber office from 12 to 1. And also we have a link for Zoom if you want to join us virtually, but we're a growing group. We have an open house on November 8th. So we bring food and have a lot of laughs. So join us for working on your 30-second commercial and for perfecting your professional speaking.
Okay, very good. And we've got Chelsea Rose here from the Colleyville Chamber. Chelsea, you guys have some events coming up as well.
We sure do. Hello, guys. Chelsea Rose, President CEO of the Colleyville Chamber. We have our November 4th luncheon at Colleyville Center. It is honoring veterans. And so we'd love to have y'all out. It is 11 to 1. We have vendor opportunities, $50 a table that people go to from 11 to noon. And then we start our program from noon to 1. So we would love to see y'all. And also we have Coffee and Commerce every Friday at Palio's Pizza from 8:30 to 9:30. We love it's, especially if you haven't been to a Colleyville Chamber event before. It's a nice way to kind of get to know. I see some people on here. Miss Mary goes to Coffee and Commerce, and it is a good time. So we'd love to see y'all there.
All right. Thank you, Chelsea.
Thank you.
And Darlisa, we are going to be moving this event to actually the Center NTX, and you're getting ready for big ribbon cutting and grand opening.
Yes, I am. Thank you, Janae, for putting that information in the chat for us. We are heading towards opening, the official grand opening. The ribbon cutting November 10th, and then November 13th will be the party in the city. So come out and celebrate. If you are interested, as Janae mentioned, if you'd like to have your company represented at the grand opening, we are about supporting small business. So reach out to Janae. She can get you squared away.
All right. Very good. We also had a shout out in the chat for the Tuesday Network Success Group at Olive Garden. I think that was pretty much about a full house, like 55. It's gotten back to being almost capacity. So if you love to network and give your 30-second commercial and meet new people, check that out. Tracy, I see that you are on. You want to just give us a quick word about the Synergy NETC that you host every Wednesday?
Yeah, we meet every Wednesday from 8 a.m. to 9 a.m. Today was our nonprofit focus, the third Wednesday of each month, we do a nonprofit focus. So if you would like to check us out, come join us on Zoom every Wednesday from 8 to 9. Thank you.
Okay, very good. Is there anything, I say the one new message? Let me just, Aaron, do you have an announcement for a community event as well?
Yeah, every Saturday we're hosting welding classes from 12 to 4 and 4 to 8. There's 2 different time slots that can be found on our Facebook page. And then starting in November, I've got Michael Lynn, 3D print everything for profit. He's going to be moving into our space and running his business out of that. So we'll have a in-house expert. So if you're interested in 3D printing, we're going to start those classes in November.
Okay, sounds good. And we'll give the last word on community events today to Mary Hildebrandt. And we've got some really dynamic women as part of this group. So you may want to check out our Dynamic Women's Alliance. Mary?
Yes, we have our Dynamic Women's Lunch the last Wednesday of October. So that is October 27th. It is over at Eventfully Yours. This is a women's event. We have a dynamic speaker speaking on the idea of hiring your protege. So helping us expand our network. So we would love to have you. You can just register at the website. All women are invited. Guys, if you have a woman that works with your business, we would love to have her join us as well.
All right. Thank you, Mary. Was there something else? Oh, Mishan, you as well.
I just have a quick request. I was wondering if someone could please email me the chat. That's all I wanted to know.
Email you the chat. Okay.
Yes, thank you.
Okay.
I have one. So we all know that Alzheimer's affects us all in some way, shape, or form. There's an Alzheimer's walk occurring on October 30th. I have a team that's walking to help eradicate Alzheimer's. It is advocacy, can be fun. I would love to see people there, and let's get rid of Alzheimer's. Thank you.
Okay. Craig, back to you.
Jack, can you mute?
Oh, yes.
Thank you, Jack, for navigating all the community updates. Lots going on. Let's see here. All right. We have over 30 folks on our virtual today, which is awesome. I think usually we typically average about 20. Today we got 30 because I think there's just a lot of love for Diedra. Oh, and Fort Worth joined us. Okay, great. We also have 10 people in the room at the NRH library. But some of the names on here are folks that I know, I've known for years. Some are new names. I want to challenge you all, if this is your first 1 million cups or you're just tuning in, apply to present. The application takes minutes. You can see the good vibes that go on, the dialogue that happens, the nuggets that get taken away. And every business, every professional, and every entrepreneur has hurdles. If you didn't have hurdles, then you're not growing. So please apply, and you can see the value that you get out of the few minutes of your presentation. Hint David, hint Michelle. But anyway, appreciate it. And again, apply to present. Also, there's been a vote was taken last week about transitioning 1 million cups from the NRH, the gracious NRH library, which has been hosting us for, gosh, about 4 or 5 months now, to the Center NTX, which is located at 5555 Rouge Snow Drive, Suite 300. The first meeting, in-person meeting at the Center NTX will be November 10th. Mark your calendars. For those of you that have enjoyed the virtual biosphere of attending 1 million cups, I challenge you to take the leap and come in person on November 10th and join us at the Center North Texas for an in-person 1 million cups.
It's going to be surrounded by Global Entrepreneurship Week, along with a pretty large agenda of other happenings such as ribbon cuttings, what have you, celebrating the co-working space, the entrepreneurial ecosystem nucleus of Center North Texas. So please put that on your calendars and carve out at least 9 to 10 for in-person to join us at 1 Million Cups again, November 10th. With that, just a little teaser is next week's topic will be a discussion around Global Entrepreneurship Week. That's coming up during that week. We're going to tease some things that are going on, why Global Entrepreneurship Week exists, what's happening locally, and what's going on very close in North Richland Hills and Northeast Tarrant County that you can participate in with regards to Global Entrepreneurship Week. Wrapping up, follow us. I think a lot of you do. Our traffic continues to grow. Appreciate it. Thank you all for your participation, your goodwill, your steadfastness to be a part of this community, and look forward to seeing you again here at the NRH Library next week to talk about Global Entrepreneurship Week. Take care and talk soon.